Okay, good morning everyone. Paddy, we can close the door there, thanks. But leave anyone in. Yeah, keep them out. Good morning everybody and welcome to the pre-budget submission of the Alzheimer Society of Ireland. I'd like to say hello to my colleagues all around the country who are watching on our live stream. And I'd also like to remember today the living with dementia who are resident in nursing homes all around the country. We always keep them in our thoughts as in any event. So we're going to begin this morning with Kieran McGowan, who's chair of the Advocacy Subcommittee of the Board of the ASI, to welcome us this morning. Kieran.
Thanks very much, Clodagh. Thanks very much, Clodagh. We're delighted to welcome you to the launch and for the pre-budget submission, and it's a critical event in the organisation of the Alzheimer Society. And the submission will outline vital investment needed to support people with dementia and their families and communities to navigate this life-changing diagnosis. Today's submission is about people who are living with dementia and their carers in each one of your villages and in your towns and in your cities. And in many cases, you wouldn't even know they're there, but they're there, really. And that's part of what it is. So we're now looking at families throughout your constituency affected by dementia. And I hope that today you'll see, hear and understand how upcoming budget 2024 will impact your constituents. And that's what we're really working for the people who are in across the road there in the Dáil really will actually listen, and it's because it's really important that we get the message across that we need to get the people working for dementia. We've come a long way from the dark days of 1982, and when there was only just two people who got together and put it together. And now, 41 years later, people with dementia and those who care and support them speak publicly and challenge stigma. And there's a network of services and supports throughout Ireland and the National Dementia Office as well in the HSE, working hard as well to improve the situation nationally. It's heartening to see political representatives here, and indeed cross-party support by the all-party Oireachtas group in dementia, which is chaired by Senator Fiona O'Loughlin, and that gives us a lot of support and positivity. And our ongoing positive engagement, which is indeed meaningful action and support also from Minister Mary Butler, who's a star to us really in terms of how this all is put together. And our ongoing positive engagement and indeed meaningful action from Mary. But there's an immense economic, social and personal cost to dementia, as shown in our recent national survey. And we can never forget the critical role played by families and communities providing unpaid care and support. So I'm just going to say that we're leaving it. The last word that I'm going to say is that we're leaving the last word to is caring for parents, for both parents with dementia, and the message that they have sent to us to say what they want to say. And what they're saying to us is they're saying, I'm exhausted. My life revolves around my parents who have dementia. I love them, but all the appointments, fighting it for hours, managing incontinence, pressure trying to keep them at home, is killing me. I feel like screaming, but I need to keep the train on the track for my parents. They deserve dignity and have cared for us all when we were growing up. So I'm proud of our submission, and I ask you to bring the submission to the attention of all the relevant policymakers shaping Budget 2024.
Thanks so much, Kieran. We're going to begin today, I suppose, text in which we bring this budget. There's 64,000 people living with dementia in Ireland, and about 2/3 of those people live in your communities and they want to remain at home. we've seen decades of underfunding of dementia. As Kieran mentioned, we have seen positive change with Minister Butler and we have a really good working relationship with her, but the scale of the issue is immense. You know, we've had strategies for other disease areas since the 90s. We only had a national dementia strategy in 2014. And what we want to see in the Alzheimer Society is a continued move from paper to practice. We have the National Dementia Strategy, we have Dementia in the Programme for Government, and just the last month we saw the launch of the Model of Care for Dementia in Ireland. And they are all excellent documents, but we need to see them made real now. The Model of Care actually sets out targets, and one of the targets is that 100% of people living with dementia will have access to post-diagnostic supports. That currently is not the case, and we really want to see action from the government to radically increase the amount of funding for dementia supports and services. But I suppose one of the reasons we do our submissions is that we want the people who have the ability to change policy and to implement that funding to hear directly from people affected by dementia. So I'm really excited to welcome Kathleen Farrell, who's a member of the Irish Dementia Working Group, and she's going to speak directly to you today. Kathleen.
Good morning, everybody. My name is Kathleen Farrell.
I'll just fix the thing there, sorry.
Okay. Lovely. Oh God, no.
You all right?
Just come out at the end.
There you go, that's low.
Yeah. Yeah. Good morning, everyone. My name is Kathleen Farrell and I'm living with Lewy body dementia with Parkinson's. I was diagnosed in 2021 and became a member of the Irish Dementia, and I hope by sharing my story and experience the future of other people being diagnosed with dementia in Ireland may change and improve. You see me here today, well turned out, I hope, but I can tell you looks can be deceiving. It took 2 days of extreme beauty salon treatments to make me feel very good today. Visits to the hairdressers, nail technicians, not to mention the stress of selecting my outfit. Seriously though, it took all my strength and determination to get me here. I know what each day will bring. Every day begins on my dementia journey, getting up, getting ready, preparing myself to face the day ahead. It's not easy. Some days I'm so exhausted before I even come down the stairs. So please remember, all diseases are not visible. And as the book would say, don't judge the book by its cover. Today I feel very privileged to be standing here in front of you, but today is not about me. Today I'm here representing the 64,000 people living with dementia in Ireland. So I would like to ask everyone here to take a moment to think of those who may not be able to speak for themselves, to think of those who have had to leave their homes and move to residential care. The day I received my diagnosis, I thought my life was over. To finally retire and learn that I had a progressive, incurable disease was devastating. Never did I dream that I would be standing here talking to you all today. The day I phoned the Alzheimer Society of Ireland, my life changed for the better. I've thought long and hard about what I need to say to you. I have learned so much on my short journey of living with dementia, and one of the things that most surprises me is the value of our air code. My air code gives me access to numerous supports. I have access to a whole suite of services. I have amazing home care support. I can access occupational therapy, speech and language therapy, and I attend cognitive therapies of all, which is supporting me to live with dementia. So when I joined the Irish Dementia Working Group, I was so surprised to find some of my colleagues had little or no service, and why? Because of where they lived. In this day and age, I find it hard to understand how someone's air code can determine what support and services someone living with dementia will get. We all know that for someone living with dementia and that they stay engaged in all activities and continue to do things and enjoy doing. Without the right support, the service is not possible. So unfortunately, if you have the wrong air code, you will not be given the same opportunities that I have been given. Everyone wants to stay in their own homes. I have yet to meet a person who says, I cannot wait to go into a nursing home. In order to stay in our own homes, we need access to support and services. The services need to be available 7 days a week. The symptoms of my dementia do not stop on Friday afternoon, so why should the support and services cease to exist on the weekend? Ask a family carer supporter how they are on a Monday morning, and 9 times out of 10 they would be exhausted and burnt out. And why? Because they have been under substantial pressure and have to continue caring for their loved one while there's no support coming into the family home. I not only know this as a person living with dementia, but also as a carer, as I care for my aunt of 91 with my sister Bernadette, who lives with me. Carers need support so they continue to carry out the amazing work they do. If the correct support and services are implemented in the beginning, the person living with dementia will stay in their own home longer. The carer support will be able to support their loved ones for longer, thus reducing the need to move into residential care. As we know, the cost of residential care is not cheap, so if we invest in early intervention and provide the correct support, in the beginning it will inadvertently save money in the long run. I'm very aware of what the future may hold for me, as are all my colleagues in the Dementia Working Group. We deserve choices on how and where we live in the future, and this should not determine on where we are living in the country. We know of our community, but we can only do this if the investments are made in the right support and services. The Alzheimer Society of Ireland have asked me what do we need and what we want. They are all experts in their field and have researched what is required in Ireland to support people living with dementia and their carers. Please listen to their ask. Time is not our friend, so please act now, as dementia cannot wait. Thank you for listening.
Thank you so much, Kathleen, and you're a real pro, because when I messed things up with the microphone, you kept going. Well done. A very powerful statement there from Kathleen. The symptoms of her dementia don't end on a Friday. So why do the services and supports? It's a very powerful reminder to us. Kathleen said that the Alzheimer Society ask her what she needs, and we do. And I think it's very important when we as an organisation come here to our elected representatives that you know what's our mandate. So we combine the lived experience of dementia and the lived experience of our teams all over the country. We have dementia advisors, we have a helpline team taking thousands of calls, we have 46 day centres, we have people going into homes and daycare at home. We have a remarkable insight into the needs of people affected by dementia. We also have robust evidence. We are an evidence-based organisation, and all of our submission is really researched and put in the context of national and international best practice. But in terms of that mandate and that lived experience, before our submission, we began our national survey on the experience of dementia in Ireland. We spoke to 72 people living with dementia and 594 family carers, and people are desperate to be heard. And just to put it in context, last year we had just over 300 people fill in our survey. People are really desperate to be heard. And the results were stark. 27% of people living with dementia said they feel lonely often. 43% of family carers had visited a healthcare professional in the last month. That's about their own health. And 43% of them rated their mental health as poor or fair, and 34% their physical health as poor or fair. Struggling with their caring responsibilities. And really of serious concern to us is 1 in 5 felt depressed role if you have the right and your mental and emotional health. But the dementia need and want, and we have a plan to support them. And with the right funding, we can support them. So I'm going to hand you over now to my colleague Cormac Cahill. He's our Head of Research, Advocacy and Public Affairs. He's going to outline some of what we're looking for that's around what the ASI can do for people affected by dementia. And then he's going to host a panel discussion with our CEO, our Head of Operations, and a member of the Dementia Carers Campaign Network. So I'll hand over to Cormac.
I suppose first of all it's concentrating on dementia specific daycare services, so it's to expand our daycare at home service activity clubs, because these are the types of services that people in the community crave. We know through COVID we had obviously lockdowns and people accessing services online, but we know from our research that these are the type of services, the in-person services that people crave so much. That's not my friend.
Definitely Mayor with the clicker.
Yeah. I suppose second of all, it's the family carer supports as well, because this is so important. I think this is one of our most research areas that we've done since our de-stress report in 2017. So we know all the evidence is there. So I suppose one of our main asks is to expand our family carer training. So we already provide this, but there are a number of people, I think it's up to around 300 or 400 people that are still on waiting lists to access in-person family carer training. And then with our counselling services, so this has come through really through our consultation period, I suppose. A lot of people feel that they need this extra service. Some people actually sign up for our family carer training, but they're not quite in that position. They need another service, and the counselling service is a real key service here as well. This is a really important one. This is a matter of fairness, of parity, and it's the pay parity for all dementia workers in the Section 39 area. Just to go through these issues in a little bit more detail, I'm delighted to be joined by Siobhan O'Connor, our Head of Operations, Andy Heffernan, our CEO, and Tony McIntyre, who's a member of our Dementia Carers Campaign Network and our Dementia Research Advisory Team. So a big round of applause, please, for our two panelists. Siobhan, I might start with you, if that's okay. We'll just wait for our other panellists to get themselves into position. I mentioned there, Siobhan, that the daycare at home service was very much an emergency service that you developed during COVID, but now it's very much an ingrained service, isn't it, part of our delivery service. The extra 1.7 million that we're calling for today, what do you think the impact of that funding would be?
Thanks, Cormac. Yeah, just I suppose to recap on the service for everybody, the daycare at home service was introduced during COVID, where our daycare centres closed. A lot of our teams, we mobilised them as an emergency service to go back into the community and look after people. What we did recognise as we brought people back into the daycare centres was that people liked a choice. Some people did not want to return. They felt that daycare was not the right, solution for them. And they loved the idea of people going in for block care, and the carer also loved the respite piece. So it worked. It was in twofold. There was a win-win on each of that, so that people could enjoy, be stimulated, enjoy activities. And it's not a task-led service, but it's a service where it's all about the person on the day enjoying what they like to talk about, what they want to do, and it's really been very popular, and we have a long waiting list for it. What I would like to say is that the ask now is to double that funding. By us doubling the funding, it obviously doubles the hours, doubles the break, and it also would allow another 400 families on top of the 400 we look after, which would bring it up to 800 families benefiting from the service. very, very important, especially for people living in rural Ireland, where they struggle even to get to a daycare centre, and in some cases they even struggle to get a home care package because of where they're living. And it goes back to exactly what Kathleen said about that postcode. Kathleen, you're right, you're totally right. And for us to be able to provide those extra hours would be a lifeline for people and families. And I've listened and talked to people that are availing of the service, and they love the service and they want to expand it.
Thank you, Siobhan. And also a part of this ask, we're asking for 600,000 funding to develop our weekend activity clubs. I mean, this sounds like a really worthwhile initiative. I mean, as you've told me so many times before, dementia doesn't end on a Friday, does it?
No, it doesn't. And, I have said that lots of times, because I do see us closing our doors on a Friday evening in our day centres. And you also know there's a lot of people with younger onset dementia which could do with something else in place for them to help support them, as they move forward in their journey, to put the right activities in place for them so they connect with other people. So we're calling out on that 600 to be able to develop that service. Again, it's not just in the ASI buildings, but there's places all over the country that close on a Saturday. So why can't we open them up and bring people together and create activities, create a sense of fun, a sense of purpose, so everybody can live well. So we are absolutely asking for that 600,000 to help support that initiative in the budget.
Tony, I might just turn to you now. Look, obviously you've been a carer for your wife Mary now for a number of years, very active member of our Dementia Carers Campaign Network as well. I mean, you've actually completed our family carer training course. I mean, would you like to tell us how you benefited from doing the course?
Thanks, Cormac, and ladies and gentlemen. You might find this hard to believe, but it's true. When I completed the training course, do you know what happened to me? It changed my life. That's what it did. Just let me briefly tell you about my situation at the time before the training, and a little bit about the training, and then about what's going on. On a typical day, I would get up in the morning, I'd sneak into the other bathroom and get ready and come downstairs. And before breakfast started, Mary would appear in the same clothes that she'd worn the day before and the day before that. And I would say to her, "You can't keep wearing the same clothes." And she would say, "No, I didn't wear them yesterday." Or she'd say to me, "I don't have any other clothes." Then I would say to her, "Look, I'm getting the breakfast, you set the table." She would set the table and we sit down, there'd be no cups and saucers. And I said to her, how are we going to drink the tea? Well, I didn't know you were making tea for breakfast. I didn't know we were going to have tea, but we have it every day. And then we'd be finished and I said to her, put the milk in the fridge. Where's the fridge? I'd say, the same place it's been for the last 25 years. It's in exactly the same place over there. So I was getting stressed, strife, worry. And then I'd say, put that jam away. Where'll I put the jam? Put the jam. But I'm not a house angel all the time, but it just stressed me out. It ended up that at one stage at 11 o'clock one night, I had so much stress and strife and worry that I had to phone in the Mater Hospital. I felt so bad. And they asked me questions and they were going to send an ambulance. I said, no, I phoned my daughter and she came over immediately and took me in. I spent 3 nights in the Mater from stress, worry and strife. Then when I came out, my daughter had found out about the training course, and I did the training course. And let me tell you how it changed my life. First of all, I opened the doors upstairs and we sorted out all Mary's clothes, her blouses on one rack, her trousers and then another rack, and then her cardigans and overcoats in another wardrobe. I opened up in the morning and she can see them because she couldn't remember where they were. Now she can see them in the morning and she's great on colours and matching and she picks out everything that she wants. And the same with her socks, underwear and all that, I opened that one up. So that was easy. Now I say to her, can you put these plates here? I tell her where to put them. I take them out for her and she does it. I point everywhere now. Now, you know when you see old people, not old people, people whose sight are getting bad, they'll get a walking stick or a white stick to help them go along. It takes them a while to get used to it. Well, the training course taught me that I point at stuff now for her. I tell her where to put the stuff. I say to her, put them dishes into the dishwasher. And the other thing I do, which had trained me, I open up the dishwasher before we're finished breakfast so that she knows to put them, because she was watching this stuff in cold water. I was getting stressed all the time, but look how easy it is once you know what to do. I didn't know. Carers don't know. God didn't make me to be a carer. He didn't give me the ability. But what he did was he gave the Alzheimer Society the ability to train me to be a carer. I'm as good a carer as I could ever be. And that's the way it is. Now we have a great life. To give you an example, we were at a meeting on last night in Porterstown at a Toastmaster meeting. We were at a Toastmaster meeting on Monday night in Dunboyne. We were at a camera club that I'm in at the presentations and on Saturday. And we were at a Toastmaster meeting in Castleknock on Thursday night. And Mary enjoys the meetings now. I haven't had one row with her in the last week. Nothing. And our lives has changed completely. So I think, Cormac, that's as much as I can tell you about it.
Tony, that's so powerful. Thank you so much for sharing that with us today. Shows the intervention, it's working by the sounds of it. Thank you for that, Tony. Andy, I might just move on to you now. Obviously today we're calling on the government to take action on the unfairness really of the pay disparity affecting all staff in Section 39 funded organisations such as the Alzheimer Society of Ireland. I mean, can you just give us your take on the situation?
Thanks, Cormac. I can indeed, and I suppose in my role with the ASI, responsibilities for lots of different areas, and certainly what we heard this morning gives effect to that, hearing from Kathleen with regard to the lived experience of the person with dementia and what makes a difference and what types of services will make a difference there as well. We hear from Tony in terms of the carers perspective as well, which is hugely important and sometimes forgotten as part of this, but certainly within ASI we don't. And then we hear from Siobhan with regard to the type of services that we do provide, be they day centres, be they daycare at home, home care, be they advisory services, and of course the training services that Tony mentioned as well. So that's a significant part of the responsibility, and huge work being done there by very, very talented people to ensure, as I say, the voice of those comes to the fore, and anything that we do provide is informed by that voice as well. But in my role, I also have responsibility for another significant stakeholder group, and that's staff, the employees of the organisation. We're approaching some 700 staff in total across the country. And time again, I visit centres, I interact with managers at national office, I meet the frontline staff, I watch them interacting with clients, and I am blown away with the level of professionalism, the empathy, the commitment, the willingness to go that extra mile time and time again, and not just our frontline, the whole way up through the organisation. People who work with us have that commitment, which I haven't seen equalled or paralleled in lots of different organisations over the years. So I take that really, really important in terms of advocating for those staff as well, because without those we will not be able to deliver the services. And I suppose from that perspective we're into a very, very new departure for ASI today in including that matter and issue of pay parity as part of our PBS, and I do think it is the place that we should be putting into it as well. I won't go into the history of it, but some people might know that there was a linkage between pay in organisations like the ASI and what are called Section 38 and HSE up to the downturn in 2008-2009. And with the financial emergency measures at the time, that linkage was broken at that stage, and we've been playing catch up ever since. So since then, we have lost our linkage. And even in the most recent public sector pay deal, which was across the entire public sector, which provided for 6.5% of an increase, which cumulatively speaking is about 10 to 11%. We haven't been funded to provide that. There's talks now at this stage about the next public pay deal being done, and we haven't even had the chance to access the previous one as well. There was a degree of pay restoration in 2009, but as I say, that certainly didn't make up that difference. And some of our staff now, the differential is probably up to 18, 19, 20%. And that's across the board from the administrative, the cleric, the frontline, the nursing staff, etc., and the managerial. So this has significant implications for recruitment and retention. And that is an issue. And I think we're lucky. Our retention is quite good, given the situation where our staff can look up the road, look at the HSE, look at a Section 39 and probably get 10-15% more if they're transferred up there. But they're staying with us because the organisation tries our best to look after them, to develop them, etc. But also in terms of their level of commitment to the people we support. And that result, I see it as it's my obligation to lobby and to advocate on behalf of those staff as well, because as I said at the outset, without the staff there's very, very little we can do in terms of delivering those services as well. Everyone I've spoken to, from politicians to public servants to whoever, have accepted the principle in terms of the pay inequity and that it has to be addressed. But at this stage, nothing has happened so far. And really, I can say to staff, I'm lobbying, we're working hard, we're talking to various people, but we need action now at this stage, because otherwise people will make that decision and they will walk up to the HSE or they will walk up to an organisation which has a different legal status than us. And that's very difficult to explain to people as well. But when you have a situation where our staff are going to the organisation that funds us to deliver services, that's just not right at this stage, in this day and age. So it is a slightly different perspective in terms of our PBS from previous years. But as I say, it follows on very much from what we heard from their previous three speakers, because without that, and they're an important part of the equation and an important stakeholder, and as a result, if we don't have those people who are trained, who have the commitment, who have the professionalism, we won't be able to deliver the services.
Very strong words there, Andy. Thank you for that. What we're going to do, we'll just do a very quick fire round, and Siobhan, you can pass the microphone up. Is there one thing you want to leave our audience with, our policymakers, government, members of the government, TDs, senators? Is there one thing you want to leave them with today?
I just want to that dementia does not end on a Friday. The people need to be supported every day of the week.
Simple as that. Tony?
I'd like to say that our home is the best medicine for people with dementia and for the carers, and I think we need money to keep us all at home.
I'd say there's been tremendous progress in the last 10 years with the advent of the NDO, the strategy, the model of care. I think it's so important we maintain that momentum, given the enhanced diagnostics will result in a lot more people requiring services into the future. So let's maintain that momentum. And I think that alliance of the policy makers, the organisations like ourselves, the politicians, the HSE, the NDO, we can make things happen. And I think it is important just to get that political will behind that as well in terms of that funding.
Just to wrap up this this part of the launch, we have a special live video that we carried out during the week, and it's a nice way to actually end it, because it's about the people who receive our services very much on the front line. So I'm just going to play a video now from Tyg and Marion Gallagher from Macroom, County Cork.
Good morning. My name is Tyg. I live in the country area, which is quite a bit away from services. We have the help of Leah to come and visit us 3 or 4 hours a week, which is great help to me and to Marion, my wife. Exercises in the morning, and we do walking after that. We walk into the forest back here.
Oh, lovely.
we're good friends so far as we talk. We have a lot of things in common with each other.
I may go to the farm, give ration to calves or cattle, count them. I could go and have a cup of coffee in Macroom or Mill Street, or go to Cork to visit my friend, maybe do a bit of shopping. I have that 3 hours on a Monday and a Friday just to be there for myself, just have time out, and I don't have to worry about Tig at home on his own.
Having a mayor with the microphone here. Thank you very much to our panel. We really appreciate that, and particularly Tony, your insight was so powerful, and it's such a good reminder that with the right support, people living with dementia can stay at home. Thank you so much to the panel. You can take a seat now. We're going to move on now. I'm going to ask my colleague, Dr. Laura O'Philbin, to outline the other 3 asks in the Alzheimer Society pre-budget submission. Good luck putting the microphone back in the stand.
I'll give it one go and then we'll give up. No, it's okay. So, good afternoon. We know that the government has invested strongly in dementia-specific home care, but we also know that need is continuing to soar, and we need a further investment of €10 million just to keep pace with demand. And we've heard Kathleen speak, we've also heard Tony speak, you know, home medicine is being at home, and it is a vital lifeline for people living with dementia, and it empowers them to stay living at home for longer. So dementia-specific home care is so, so important. We also, as Andy has mentioned, we really need this government to address the recruitment and retention crisis across the home care sector. In my recent research, 2/3 of people who are in receipt of home care had actually experienced a delay or reduction in their service due to having staff shortages. So that is a big, big issue. Can you imagine how distressing it must be to expect a home care worker to come and they can't due to staff shortages? So we have to value home cares, and this government must act fast to protect home care. So the ASI has recently published evidence that highlights how important the clinical dementia nurse specialists are, and they greatly improve the hospital stay for people living with dementia. And this is important because people living with dementia experience substantially more extended hospital stays, more adverse events, and poorer outcomes than similar patients who do not have dementia. So we need at least one clinical dementia nurse specialist in every acute hospital across Ireland. The model of care for dementia, so we've heard earlier that the model of care can only be as useful or as impactful as its implementation. And a fundamental step for this is to invest €1.4 million for 2 additional memory assessment and support services. So this is where multidisciplinary teams can diagnose, assess and provide post-diagnostic support to people who are not only living with dementia, but people who are concerned about their memory as well. And look, I hold my hands up, I might be a little bit biased, but it is a fact that dementia research is underfunded relative to its importance. The impact of the disease on the individual and the impact of the disease on society is huge, and we do not have enough investment in dementia research. In Ireland, we're so lucky, we have great research talent, we have people who really want to make change happen, but we need investment to ensure consistent innovation and best practice, especially in this changing dementia landscape. And we need to provide adequate social protection for dementia carers. I think we've heard a lot today about the impact of caring on family carers. And we have Irish data from 2022 and 2023 that shows that family carers are struggling financially, physically, and emotionally with their caring role. And what's really concerning is these financial challenges are actually leading to people cutting back on some of the very things that we all need to maintain our mental health. Things like seeing our friends, engaging in hobbies, going out and about. People can't afford to do that now, and it's turning into this vicious cycle for family carers. The cost of living crisis is impacting all of us, but it is just disproportionately impacting family carers, and we really need to remember that. So the Alzheimer Society of Ireland is asking for an increase in carers allowance by a minimum of €27.50 per week. We need to make the carers allowance a qualifying payment for the fuel allowance, and we need to recognise the cost of caring in the allowable deductions for carers allowance, including medical expenses and fuel. These are currently not recognised. And finally, Clodagh spoke, about our mandate and the national research that has informed this, with over 650 people who are affected by dementia. My team and I are currently analysing the data. Kieran read out a quote earlier. It is stark and it is scary, and I have to say it is hugely, hugely concerning. There's one thing that I understand now from reading that data, and people with dementia and their families, they are really, really struggling and they need our help. So I urge everyone in the room today to please take action as we approach Budget 2024. Thank you.
Thanks so much, Laura. That ends the formal part of our submission. It's been a really interesting morning, I think, having the input from Tony and Kathleen to give us that lived experience of dementia, to have that data that Laura presented. We're such an evidence-based organisation. Those statistics are really stark, and we do need to take action to ensure that people affected by dementia aren't slipping further into poverty, further into poor mental health, and that they have access to the services and supports that they need. Before we finish today, if anyone would like to make a comment or ask a question, you're more than welcome. Or if someone has a question for the panel, or someone would like to make a comment. Kevin. Yeah, this is Kevin Quaid, Chair of our Irish Dementia Working Group.
Thanks, Laura. One thing I'm thrilled to see on is dementia nurse specialists. I can't tell you how vital they are, or I can't tell you how vital enough they are, because I had first-hand experience. I was in the Mercy Hospital in Cork. I was on 19 different medications. They took me off 13 of them. But I was being seen by 8 or 10 doctors, and the way they come around in teams in the morning. Yeah. Here am I, a dementia patient inside in bed. You can go home tomorrow, you're staying for a week, and all this information. And a nurse see me crying one day, and she came over and said, "What's wrong?" I said, "I can't handle this. I can't handle the information I'm being given. I can't process it even." And this lady came over, and her name was Yvonne Allen, and she said she was a dementia nurse. And the very minute she said she was a dementia nurse, the relief I got. And she said, "Tell me the problem." I said, "There's doctors coming around that tell me I'm going home tomorrow, they tell me I'm staying for a week. I have no idea what's going on." And she said, "How about if the doctors come to me, they tell me what's happening on a daily basis. What time does Helena come in?" I said, "She's normally in around 4. I'll come up and meet the two of you guys, and I'll explain to you then." Me as a patient lying in that bed, it made my life so much easier. I didn't have to worry about how am I going to remember to tell Helena this. And I got to be great friends with Yvonne over the 2 weeks I was there. I was there, I think, March or April. This was in the Mercy Hospital in Cork. And the sad thing was that her contract ran out in September. And I got a letter. I wrote and complained about it. And I got a letter saying that it was great news. Her contract had been extended for 6 months. To me, that was a disgrace, an absolute disgrace. But I have met her recently, and she's in UCC in the Cork University Hospital full-time. And I think what the government need to understand is, and everyone needs to understand this, Laura, you said, if there's a dementia-specific nurse in each hospital, and a dementia patient goes in and they're identified, it frees up nursing hours, it frees up doctor's hours. They know they can go to the dementia-specific nurse. I'm not being left out of the loop, but at least when I'm being told with my carer or my supporter. And that for me was just simply invaluable. Thanks, Clara.
Yeah. This is Helena Quaid, Chair of the Dementia Carers Campaign Network.
I would just like to say that I found today's pre-budget submission, the last few words there, so interesting, and we all need to remember it. Dr. Laura was speaking about the financial impact on carers, and as I'm trained in naturopathy and acupuncture and a holistic therapist, For years and years and years, I was telling my clients, you know, you really have to watch your mental, physical and spiritual well-being. To feel good, you have to do all of these things. And today, Laura and yourself were speaking about the financial difficulties, the financial impact on carers. So therefore, we need to add a fourth to that. So it's mental, physical, emotional and financial. If you're a dementia carer in Ireland today, it really does impact us negatively.
Thanks so much, Helena. Very powerful. A very powerful testimony from Kevin on the power of the dementia nurse specialist, and from Helena on that financial impact. It's very hard to be caring and wondering how you're paying the bill, how you're going to pay the mortgage. Deputy, did you want to? Yeah, and then we'll go to Marguerite. I should say we did book more than one roving mic, but we only got the one. So.
It's working, though. That's always an advantage.
Thanks very much. Paul Donnelly, Sinn Féin TD for Dublin West. Just two things I wanted to talk about. 5 weeks ago, my wife's mother passed away of dementia. And it was very quick. It was only last November where we really got a diagnosis of the dementia, and it was very rapid, really quick. But that period of, say, from August, September last year up until December was one of absolute trauma, of concern, of fear, of all of those things. And the fact that she lived in Derry and we lived in Dublin. Another sister lived in Coleraine and one in England, so there was nobody around her. And it was so difficult for my wife and her family to deal with that. But we did get a lot of support, and we did a lot of information from the website, just trying to figure out what was going on, because obviously until you get a diagnosis you don't actually know what it is. So I mean, I just think it's absolutely phenomenally important that people are able to access that support when you need it. And a lot of times, you know, look, we come to so many of these events, and it's only when you really see it and you need it is when you realise how important organisations like this are. And the second point I'd like to raise just is around staff retention and recruitment. And you know, I raised this just last week with the Minister, and again we're getting lovely words and that they recognise that this is a serious problem, but we knew this is a problem from day one. From the minute that the uncoupled Section 38, Section 39s, 56 and 10s from the public sector pay agreements, that's when the problem started. And it hasn't been, we haven't got the firm commitment that this is going to change. And it's not just the Alzheimer Society, it is every single one of those organisations are really, really struggling to keep staff and to recruit staff. And I'm a board member of a community drug team. We put up a job advertisement, well paid, it was a very good job, and we got two people who applied for the job. You can't do an interview process with two people. So we're struggling. We've 3 jobs that are out there that we're struggling to, and these are the most vulnerable people in our society that we are struggling to recruit for. So, you know, we'll continue, certainly on my part, and I know on the part of Sinn Féin, we will continue to press for pay restoration, because it's the only way that you're going to retain and recruit staff. Thank you very much for this morning. Appreciate it.
Thanks, Deputy O'Donnell. I'm sure your mum will be very proud. Yeah. I'll go to Marguerite Keating now, who's a member of the Irish Dementia Working Group.
Thank you. My name's Marguerite Keating, and I'm a person living with dementia, and I live in rural Ireland in Cashel in County Tipperary. And when I was diagnosed, around that time, it was the first time in my life, I'm a bubbly person, but it was the first time in my life I really contemplated on taking my own life, because I had a 14-year-old at home who had become my carer. That's not official, she didn't get paid, she's now 19, and she can't really go anywhere unless she lets somebody else know, because of things that could happen or have happened to me. So I've had a 14-year-old minding me that's not considered a carer, and it's impacted on her life. I am not old enough to be considered for a day care centre. I'm not really on the board of having Alzheimer's because I'm not old enough, even though I've been diagnosed 4 years. We don't even come into it. I'm on the waiting list for daycare help. I am an advocate for people. I fight very hard. I do my research and my writing and everything that I can. I'm part of Europe Dementia Working Group as well. And I can't do that unless I get some help and support. I'm great to write everything out, but transferring it from that to a computer, I have problems remembering what to do. If I got those supports from our team, it would help everybody else. Everyone that I get help from is in the Alzheimer's Society. If they're not paid the proper amount of money, they're going to walk, and that means people like me are not going to have the supports. Thank you.
Thanks, Marguerite. This is our final comment from the floor now. I'm going to hand you over to Helen Rochford-Brennan.
Thank you. Thanks, Clodagh. I just wanted to also address pay and equity because I think it's really important. As somebody that's been around for a very long time and has had the privilege of having support through over 10 years, I want to say that sadly all through the years I've seen so many great people move on because of the lack of pay, and in particular in more recent times. But there's one thing that, Annie, I just want you to always add when you're talking to our lawmakers across the road and anybody that is. People with dementia, unfortunately, many of us also have anxiety, and change is not good. So if you're going to be constantly, take for example, ASI, train them up. I've seen it in other organisations I've trained, and who did they move on to? A lot of them. They move on because they get a few euro more per hour with the HSE. And so we want the same people as much as possible. Yes, we know that they have to go on their holidays and that there are times that they cannot be with us. But as somebody that has the privilege of having home care at home and given me a wonderful quality of life, I want to honestly let everybody know the importance of keeping our team. They deserve to be paid from the top to the bottom. Every single member of staff deserves to have the same level of pay as our colleagues in the HSE. It should not be different. A carer is a carer. You know, so an administration staff is the same. So they should be on the same level. And I am very passionate about it, as you probably heard.
Thanks so much, Helen. We're going to finish there today. We're very grateful to all our colleagues who tuned in on the live stream. We're especially grateful to all the TDs, senators and political staff present. We know it's a very busy day in Leinster House. When we picked the 29th of June for the pre-budget submission a few months ago, we could not have anticipated what else might be going on in the House. So we're very grateful for all of you joining us. Everyone has our full pre-budget submission in their inbox, and we urge you to invite the government to act and support people affected by dementia. Thank you. I don't know how to turn it off.